Good evening, friends. Welcome to this live session on tackling tobacco, the biggest cause for India's biggest cancer. Please allow me to introduce myself. I'm Dr. Vijay Haribhakti, and I am the Director of Oncology at the Sir H.N. Reliance Foundation Hospital. At our hospital, we treat a very large number of patients with all types of cancers, and it is our very, very strong conviction that every cancer should receive the attention and, in fact, the preventive attention that is possible. Let me start by saying that the World No Tobacco Day to me represents one of the most important days in the calendar of an oncologist or of an oncologic patient. Why do I say that? I think we need to realize that tobacco by itself is singly responsible for 50%, mind you, a whole 50% of all human cancer and of all human cancer death. And I'm sure a much higher percentage of human suffering. And yet, it is a habit which we simply haven't been able to conquer. Let me talk to you a little about how and why tobacco is able to do this. We must realize that tobacco, taken in any form whatsoever, whether it is chewing tobacco or it is smoked tobacco or it is snuff-dipped tobacco or any other form of tobacco, the most important thing is tobacco contains a large number of carcinogens, and its active ingredient is nicotine, which is habit-forming, which actually produces a physical dependence. And therefore, it is a huge trap. People start off early. We are very familiar with the fact that in the BD industry, many children are employed. So they are exposed to this carcinogen at a very young, tender, impressionable age. And that's when they begin. We know that in the general population, even in the educated masses, we find that it starts as a social habit. Teenagers think it's cool to hold a cigarette and smoke. And before they know it, it becomes a habit. Take the huge class called the working class, whether it is skilled or unskilled labor, anything that is repetitive. For example, we have many patients coming who work in the diamond trade from Surat or from other parts of the country. So they have to do the same thing for hours together each day, and they begin to feel that tobacco helps them maintain their attention, maintain their ability to work, and therefore they get hooked onto it. So there are many occupational reasons which people find as valid excuses to get onto the habit and then stay on with it. Now, what are the factors that really produce the damage? We must understand that whereas tobacco and all the condiments that go with it, whether it's supari or chuna or all the other things, ingredients that go into those little packets that are sold, we must realize that the most important thing that it does is it promotes poor oral hygiene. It actually takes away from oral hygiene. What happens is people are so used to keeping their mouths busy. Many of them, you've obviously seen many people mixing up the tobacco and chuna in their hands and forming a quid and putting it at the corner of the mouth and then working for hours. And this is the problem. There is prolonged contact. There is high concentration of nicotine in the saliva. There is direct damage to the teeth, giving rise to sharp and carious teeth. There is poor oral hygiene, poor oral defense. And most importantly, what chewing tobacco does is it produces a chronic irritation of the lining of the mouth, a condition which is kind of unique to the tobacco chewing nations in the world and our country in particular, a condition known as submucous fibrosis, in which the whole lining of the mouth becomes thick and board-like. Patients finally cannot even open their mouths or can open their mouths only minimally, precluding good examination, good dental care, good dental attention, and finally even not allowing a good assessment of a tumor or an ulcer when it forms. But let me tell you, this is only the beginning. This is about chewing tobacco. What does smoking do? If it's bidi smoking, the smoke taken by the bidi is turned around in the mouth, is held in the throat, and it gives rise to the highest incidence of cancers of the back of the tongue, the base tongue, in populations where that habit is rife. When you go to cigarette smoking, the cancers descend further. It's the voice box, so the larynx gets affected. And most importantly, it is the highest single cause of lung cancer, which is the second most prevalent cancer in males in our country. The loud and clear message I want to give today is tobacco produces cancer in many, many sites of the body, whether it's the mouth, oral cancer, it's the throat, you have voice box cancer and food pipe cancer. Moving further down, you have lung cancer, you have urinary bladder cancer. All those cancers are intimately related to tobacco habits. And let me tell you, after all these years as a surgeon, I have come to a very clear and a very humble conclusion that we as surgeons cannot solve this problem. The problem is way too large. There are just not enough trained surgeons, and there's just not enough resources. It is an extremely expensive disease to treat because one of the hallmarks of tobacco-related cancers, especially mouth cancers, is the high incidence of not only advanced cancer at presentation, but of recurrent cancer, which is an unsolved problem. So let me say, we are talking about a health problem, a very, very major health problem in our population, which is almost entirely preventable. I know it's easier said than done, but really think about it. If you could internalize this simple message, if you could share it with your friends, your family, people working in your homes, everywhere, the difference it would make is huge. Let me end by sharing with you a little campaign that we have at our hospital started recently, and it is mainly for prevention of cancer. And it goes by the acronym SEEDS, S-E-E-D-S. The first S is shun tobacco. Shun tobacco in all its forms. So please, that is the most important part of the campaign. The second E is eat right. Eat the right things. Make sure that your diet is adequate in natural vitamins, minerals, and trace elements. The next E is so eat right, exercise regularly. Very, very important. It's a truism which is ignored by so many. So exercising regularly makes a very big difference and helps reduce many cancers. The next is D, which is dump obesity and excess alcohol. You must know that obesity by itself is responsible for more than 10 important classes of cancers. A very, very important cause of cancer in all populations in the world and also in ours. And the final S is stay vigilant. You need to be vigilant about your risks, about the early warning signs of cancer, and about the fact that presenting early to a doctor, by that getting your cancer diagnosed early, makes a big difference to treatment. So my message to you is very earnest, very simple. Shun tobacco in every possible form. Encourage all those around you to do the same. It'll go a long way in making us a healthier society. Thank you very much.